Hello friends, welcome back to my channel Health and Fitness in Children. Today I am going to speak about the topic which most of the people are discussing about, the Delta variant and the third COVID wave in India. So let me start from the beginning. What is meant by viral mutations? So virus, when it infects a human being, it uses the cells of the humans to replicate itself. Whenever it is undergoing a series of replications and copying, there are small slips which we call it as mutations. So small variations do come out of the same virus. Most of the times, these mutations are not worthy, they are milder, they fade away without causing any discomfort or harm to anybody. But once in a way, there will come a more potent viral mutation, and these are then classified by the WHO into two main categories. One is called as the variant of interest and the other one is called as variant of concern. In the variant of interest category, these mutations are more transmissible than the previous editions. This means that these viral replications can transmit from one person to another in a more faster method. However, they are not more deadly than the previous editions. When we talk of variant of concern category, these viruses, they replicate more faster, they are more dangerous, they can infect human beings at a faster rate, they cause more hospitalizations in people and probably more mortality. So the first variation was called as the British variant because it was found in Britain. Then subsequently one more variant, a dangerous variant, was found in South Africa, then Brazil, then one variant in India. So instead of naming the countries, WHO now has given them alpha, beta, gamma and delta variants. So today I am particularly talking about the delta variant, which was identified as early as October 2020 in India. In India, when we had the second wave which happened between April and June, delta variant is supposed to have been the major culprit and cause. There was a very interesting study done by ICMR, which is Indian Council of Medical Research. They took up patients who had suffered from COVID disease after completion of 2 vaccinations. They took up 677 subjects from 17 different states of India. So these were the points they found. In the 677 people, about 89% of the people had received Covishield vaccine, 10% had received Covaxin, and about 2% of people had received a vaccine from China called as Sinopharm. So although Covishield numbers seems to be high, but we have to remember that in India, Covishield started giving vaccinations early, so it could just be a mere coincidence. The second point, when they looked at the type of virus which was there, more than 86% of these people who were infected were positive for Delta variant of the virus. So this data suggests that if Delta variant is to be there in India, people can still get it even in spite of getting 2 vaccinations. Out of the total 677 people who were studied, 70% had symptoms and 30% did not exhibit any symptoms at all. 10% required hospitalization and 0.4% was the mortality. So now if we look at the mortality which is at 0.4% and compared to the national average whilst the second wave was going on, which was around 1.5%, we can clearly see that mortality has come down after getting the 2 vaccinations done. So the message is loud and clear. even if Delta variant is to be there in India, if we all get 2 doses of vaccination done, then the chances of us getting severe disease is much lesser and the mortality is much lesser. Will third wave hit India? Now let us look at some of the data from America and United Kingdom. United Kingdom is seeing 50,000 cases every day, which it had not seen since January 2021. If you look at American data as well, the cases seems to be on the rise. Now, if you look at their second wave and now the sudden increase, there seems to be a gap of 12 to 16 weeks. If we now take the same parameters and apply to India, we had a peak wave going on from around April 15th to around June 15th. So if I were to leave 12 weeks, we are looking at September as the onset of this third wave. It could be as early as August end or it could be as late as September end. Now, if you look at India, we are getting 35 to 40,000 cases on a daily basis. This could potentially increase to 1 to 2 lakh cases per day. Still, the good news is it will still be lesser than the peak caseload of 4 lakh cases per day in India during the peak of second wave. There are 2 or 3 reasons for this. One, vaccination. We can see that India has already completed 40 crore vaccinations and 40 crore people in India have received at least 1 dose and 8 crore of them have received at least 2 doses. There was one more interesting news item in the papers a couple of days back. 68% of Indians seem to have antibodies against COVID. This is because of a combination of vaccination and people who have got infected and then have developed antibodies. So which means 2 in 3 people already have some sort of a protective cover against this virus. Second, as I have told about the ICMR studies, even though the Delta wave can still infect people even after the 2 doses, it seems to be protective in such a way that the hospitalization is lesser and mortality is significantly lesser. There is one more good news out there for parents. Zydus Cadila has done successful studies in giving COVID vaccinations to children and their data seems to be encouraging. So if this is proved, we could see this vaccination for children as well very soon in the market. So what are the take-home messages from this video? One, people who have not yet got themselves vaccinated should go and get themselves vaccinated at the earliest. And if people have completed their first vaccine, they should go out and complete their second vaccine. Till the time the whole of the country is vaccinated, we should still continue to wear the masks and maintain the social distancing. Thank you.